Hello my dear friend, in this video I will discuss about the lateral medullary syndrome, which is also known as the syndrome of Wallenberg. Before going to the lateral medullary syndrome, we need to understand the blood supply of the medulla oblongata. So medulla oblongata is supplied by the two vertebral arteries, anterior and posterior inferior cerebral arteries, basilar arteries, and anterior and posterior spinal artery. Let's understand the arterial supply of the medulla oblongata in the 3D view. If we zoom it, here is the posterior aspect of the human body, and this is the anterior aspect of the human body. If we zoom it and remove the atlas and axis vertebra and cerebellum, we can easily able to see the arterial supply of the medulla oblongata. And this is the medulla oblongata on the left side and the medulla oblongata of the right side, which is supplied by the two vertebral artery. The vertebral artery of the left side, which is arises from the subclavian artery of the left side, and this is the vertebral artery of the right side, which is arises from the brachiocephalic trunk, part of the brachiocephalic trunk, and the supply the medulla oblongata. And if we zoom it further, the vertebral arteries gives a branches, posterior inferior cerebral arteries on their respective side. And if we see from the anterior view, and it gives a branch and from the both vertebral artery and from a basilar arteries, and from the basilar artery a branches is arises, which is anterior inferior cerebral artery on the respective side. So anterior inferior cerebral artery and posterior inferior cerebral artery, and is along with the two vertebral artery supply the blood to the medulla oblongata, and the posterior inferior cerebral artery and anterior inferior cerebral artery also supply the blood to the cerebellum. Especially the posterior inferior cerebral artery supply the blood to the inferior aspect of the cerebellum. Along with this, anterior and posterior spinal artery also supply the blood to the medulla oblongata. In this 3D image we cannot able to see the anterior and posterior spinal artery, which is comes from the spinal cord and also supply the medulla oblongata. From the above 3D image we can able to find the location of the posterior inferior cerebral artery, which is mainly responsible for the supplying the blood to the dorsolateral aspect of the medulla and the inferior surface of the cerebellum. If the thrombosis of this artery occurs, then the wedge shaped area on the dorsolateral aspect of the medulla and the inferior surface of the cerebellum is affected. So here is the transverse sections of the medulla at the level of the olive, and this is the anterior aspect and this is the posterior aspect. Here is the dorsolateral aspect. This is the dorsolateral aspect, and the posterior inferior cerebral artery is supplying the medulla at this region, and due to the thrombosis of this arteries, this area is affected. This area is affected, which causes the dysfunctions of the structure present within those area. First of all, we talk about the tractus solitarius, which include the cranial nerve 9, 10, and the 7, and the fiber of the 7th cranial nerve receive the taste from the taste bud in the anterior 2/3 of the tongue, except the palate papillae, and the fiber from the 9 receive the taste from the taste bud in the posterior 1/3 of the tongue and the palate papillae, and receive the touch, pain, and temperature sensation from the pharynx and posterior 1/3 of the tongue, and fiber of the 10th cranial nerve receive the general sensation from the thoracic and abdominal viscera, and also receive the taste from the taste bud in the posterior most part of the tongue and epiglottis. Due to the defect in this area, the sensation, the taste, general sensation of the thoracic and abdominal viscera, touch, pain, and temperature over the pharynx all are lost. So here is the vestibular nucleus, so it is responsible for the balance, and due to the defect in the vestibular nucleus, it also causes the giddiness, nausea, and vertigo. This is the anterior ventral and the dorsal spinocerebral tract. Due to the effect in this area, this tract is also affected, mainly the dorsal spinocerebral tract, which whose fiber is goes into the cerebellum through the inferior cerebral peduncle. This is the inferior cerebral peduncle, so which is responsible for the ipsilateral muscle coordination. Due to the effect of this structure, it also causes the ipsilateral ataxia. and it also causes the dysfunctions of the lateral spinothalamic tract, which is responsible for the contralateral pain and temperature sensation, and whose fiber is deconstructed at the level of the spinal cord, and due to the defect of this tract, it also causes the contralateral loss and loss of the temperature and the pain. It also causes the deformity of the spinal nucleus. This is the spinal nucleus in the tract of the trigeminal nerve, which is responsible for the pain and temperature sensation over the face, and due to the defect, this sensation is lost ipsilaterally, and it also causes the dysfunctions of the nucleus ambiguous. Nucleus ambiguous include the cranial nerve 9, 10, and 11, and they gives the motor fiber to the muscle of the larynx, pharynx, and the palate. On the ipsilateral side, due to the defect of the nucleus ambiguous, it also causes the ipsilateral paralysis, and from the regions of the reticular formation, descending change of the sympathetic fiber is goes down towards the spinal cord, and due to the involvement of the descending sympathetic pathway in these reticular formations, it also causes the Horner syndrome, which result the meiosis, pitosis, and hydrosis. Thank you.